We're back with my guest, Gary Wade, and we're talking about this machine that you've invented.
Horse magnetic pulsar.
Horse magnetic pulsar. I keep wanting to say equine. I don't know why.
Well, that's a horse.
That's a horse. That's why I slapped me. Anyway, one of the things that you mentioned in the last segment was that there's a low-grade infection.
Can happen, yes.
It can happen, but it doesn't always happen?
No.
All right, like in a human, how do you know if you have this injury and a low-grade infection?
Well, it's hard to say. I said no to the low-grade infection earlier than always, but actually it does. When you take a look at blood, for instance, with a good microscope, high power and all that sort of stuff, blood usually looks relatively clean, but all blood is contaminated at some level with bacteria and viruses. And it's always flowing through your body. So when you suffer a really traumatic crash into something and do tissue damage, you can do gross tissue damage and you do fine tissue damage all at the same time. And so you'll have places where you'll rupture delicate veins and vessels and some fascia and pick a story, as they say.
Right.
Anyway, but blood will percolate into these damaged areas. On people, it's called bruises and whatnot. I got really hit, and oh, look, it's all discolored. That's bleeding internally. Well, whenever that happens, blood goes to places it wasn't designed to go. And there'll be little nooks and crannies, and some of the viruses and bacteria, they flow with the blood, and they'll go into that area. White blood cells will come in, and a whole bunch of stuff will happen, inflammation reactions, blah, blah, blah. The body tries to heal itself. Fibroblast cells come into the area to fix it. They secrete collagen fibers that holds everything together. And if the body really can't fix the area, then in that fibroblast cells and those collagen fibers become what we call scar tissue. Mm-hmm. And scar tissue can be gross scars. We all see, what happened there? Oh, I was kicked by a horse. Yeah. Or there's other type of scar tissue that's real small and fine, so small you don't even see it with the eye, that you develop over the years through all your tissue.
Or it can be internal.
Yes. So anyway, when you really get racked and you do a bunch of damage, this blood goes in there. Body tries to clean up the area, but the microbes go into places they shouldn't be, and some of them survive. Don't get killed by the white blood cells, and they set up shop in the tissue, in the scar tissue, and in the periphery. And so that infection can grow and get out of control quickly, and then because it'll be inflamed and it'll be hot, warmth, and all that stuff.
Right.
So that's an obvious, we've got an infection going. But there's low-grade infections where none of that happens. It looks like they're healing up fine and everything, but the truth is there's still low-grade infection in the tissue, and it'll be there for years, and it will flare up every now and then too, causing problems.
Right.
It happens in people, it happens in horses. Well, the Einstein School of Medicine back in the, mid-'80s, they discovered that if you get a certain amount of electric current flow through like a salt solution, like in your blood and whatnot, that once the current density gets over a certain amount, it starts deactivating the viruses and bacteria and whatnot, so that you can clean the blood up with an electric current flow through the blood. And the blood is still very viable, no damage.
But the one thing about horses, all animals, not humans, but the rest of the animal kingdom, is that when you treat an animal, if it works, it works. Mm-hmm. And you can tell because they don't, they're not trying to fool you. They're not talking themselves into the fact that this can't possibly work. Or
placebo effect.
Exactly. I mean, it either works or it doesn't with an animal, especially horses.
Well, you can tell here because you can move the coil over and diagnose where the damaged region is.
Right.
You can then
they're going to feel it immediately.
Oh, yeah, you can tell. Mm-hmm. And then you start treating the area, and then you just watch the progress and see how it goes. Most of the times, things clean up very nicely. Now, it may take 1, 2, 3, or a dozen, depending on how damaged it is.
Treatments.
Exactly, and what type of damage it is and which tissue. Every horse is...
But I'm thinking let's just take reining horses. Mm-hmm. Even if they're not damaged, if they haven't had an accident, they haven't fallen or slammed into the barn or whatever, they still could just for
it's
working
a tonic
every
effect.
day, and that could just help them before they go into competition.
Quite often, the people that have the machines and whatnot will tone their horse up before the event. They'll just take the coil and work it over areas that are healthy and whatnot. It has like a tonic effect, and they say that. Well, I've talked to people like in barrel racing, which is a very demanding, whatever.
Turning, yeah.
Before and after, comparing before they had the coil to use on the horse and after, they're so much faster.
Well, let me ask you another question because we're running out of time. Mm-hmm. When you go to the state fair, you go to different functions, you'll sometimes see that they're selling magnets, and you can strap a magnet on yourself or something like that. Is that what this is? And do those work?
Yes, they do. And no, this is not. That magnets, that type of magnet situation actually speeds up enzyme reactions in the cells.
So they do work.
Oh yeah, absolutely.
Somewhat, but not like what you have.
Yeah. Well, again, you have to match it for each thing for the right condition.
Right. Gotcha.
In our case, we have a polarity on the coil, and we do use the magnetic field, its magnitude, to help a little bit. But in our case, it's mainly the rate of change of the magnetic field that's doing all the interesting work.
Okay.
We can get the muscles to flex without the horse having to flex them. We can make the whole area just kind of go pump, 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 pump. And each time it's doing that, the lymph fluid is being pumped through the area. So we get lymph fluid, bring new nutrients into the area, and the old stuff, waste products, are taken out through the lymph system.
Now, Gary, let me tell you something, okay? Because I think we could go on for another hour about this, and we're out of time. But there's people watching right now that are thinking, oh, you know what, my vet should have this, or we want this in our training barn, we want to find out more about it. How do they find you, and where do they find the information?
I have a website where I have the basic information of how and why, like the story I was telling my friend. It's horsemagneticpulsar.com, and the pulsar part is with an E-R at the end, not an A-R.
Okay.
Horsemagneticpulsar.com, and I have a story of how the whole thing came about. I have real technical information about what the thing does, and I have the treatment protocols listed on how you would use it on a horse.
All right, so they should just go to your website and go from there. Gary, thank you for being a guest.
I'm very happy to be a guest.
What an interesting man you are, and what a great product.
Yes, it is.
Thank you so much. So if you're interested, go on his website, take a look, and whether you want it for your barn, if you have a lot of horses in training, or maybe you think your vet should have this.
Or your trainer.
Yeah, or your trainer. It's a great idea. We'll be right back.